but all of our press conference people are there.
Okay, hold on. Now we're good.
Okay, I see a red dot. All right. Welcome to a new thing we're trying at the City of Pensacola. We appreciate you being on. We have a press conference here. I want to remind you of a couple of things. Obviously, we're doing this remote. So in there, you may see some hesitation. If sound pauses in or out, it may take us a little while to work through it, but we are getting through there. Also realize, I think Casey has talked to you about how we need to get questions in. And then finally, this is being recorded live and it will be played out for all the public to see. So we have a chance. I want to say a huge thank you and appreciation to both Trudy Nichols and Casey Lagarde, who have put in a lot of time and energy to make this work. I told people, I said, listen, the City of Pensacola is on cutting edge. What we're doing right now and some of the things like this press conference that's virtual, we are doing that. And it's not that we didn't have the technology, we just hadn't really gone and pushed ourselves. But I think this is causing us to test ourselves in whole new ways that we never realized were going to be there. So I appreciate you joining me this morning, and we'll have a regular press conference. I'll just go through some things that I'm talking about, and then I think if you submit questions, I'm more than happy to answer those and see what's going on. Despite me being here at 4165 Baysden Road, I will say the City of Pensacola is working hard. I was out watering some plants we put in this weekend. I think everybody is right now doing stuff in their yard, and I saw a Pensacola sanitation truck going by, so they are definitely out there working. Also, I will say that I know we are seeing a huge amount of sanitation pick up from yard debris. So if we're a little behind, it is just everybody's been out in their yards since they can't go anywhere else. So please have some patience with us. We will get through there. We will get all these things picked up, but they are going through. I guess the other big thing that is happening is obviously we're able to do this at home. I know the question that everybody's asking, and I told my staff earlier, I am wearing pants, so I do have on pants, but so I know that's been the question out there with everybody doing a home broadcast. I just wanted y'all to know so you didn't have to ask that question later. But let's go ahead and get started. We have coronavirus. Obviously the biggest part. I did want to discuss at least last week. Obviously, you know what happened with me individually with my family. My son is tested positive. He's doing better. We're on day 4 here at the Robinson household of being quarantined to the house. He is doing fine, recovering. He's young, so he should be fine. He was real good on Saturday. He was a little bit not as good on Sunday, but today he woke up this morning and we saw him and he was doing very well. So I appreciate all of your thoughts and prayers and appreciate everyone out there that sent stuff. I can't tell you how much it's meant to both Jill and I, and we certainly appreciate all the thoughts and prayers that are happening at this time for us. And I just want to let you know what we were doing. I also wanted to let you know again that I have tested negative. However, city policy is that either you need 2 tests or 14 days. So I'm continuing to quarantine with my family and may look to take a test later this week just to be sure that I'm all good and don't go back to City Hall and contaminate anything. I will say City Hall is not open to the public, as many of our places aren't, but I can tell you our people are working. I talked with Keith over the weekend. I know our goal is the state has asked for 50%. I believe the city right now is running about 52, 53%. So we are running very good in what the state has asked us to do. And we are platooning people. Some people are coming in. Some people will be in the next time. So I did want to discuss a couple of things. I know that we've certainly got reported what is 125 cases. I also at least wanted to communicate what I received. I received 2 things in. The usual thing I think I try to send out there to you guys, I got in today from Sacred. This is just Sacred's numbers. Again, this is their testing site. They've done 2,941 total tests. They've returned 2,685. So about 91% have been returned. We still have some outstanding, and we are working right now with the governor's office to obtain other equipment that will allow us to catch up to almost a 24-hour on everyone. If we can just get some additional equipment, which we're trying to work on, and I know our state legislators out there working on, and I appreciate their hard work, we're going to get there. Right now, we have 140 positives out of that 2,685. That's about a 5.2%. Again, this is only Sacred Heart. So out of their 140, Escambia County has 86, Santa Rosa 32, Okaloosa 6, Alabama 6, Walton 2, Florida, other counties 3, and other states 5. So that's kind of what was put together. I know they're also doing some joint reporting, and again, this is from Sacred stuff. I don't have the joint reporting at this particular time, but I do have at least something they've put together. Right, technology. All right, samples collected: Escambia County, 1,633 samples. Negative was 1,422. Positive 86. Pending are still 125. And that's roughly about a 5.7% hit rate in Escambia. Santa Rosa has 783 tests that have been done. 682 have been returned. 32 are positive, and come on, open up. All right, and 69 are pending. That's a 4.5% there. The others and the unknowns are still, they're running at a hit percentage of about 4.6%. So again, Escambia County is having the highest percentage hit. But I mean, again, I think what we've seen everywhere with this virus is that the more densely populated you are, the more of an impact that is being felt. So again, that's no different here. Again, we encourage everyone to continue to follow the CDC guidelines in taking preventative actions, even when you feel perfectly healthy. The new guidance from the CDC now recommends wearing a cloth face mask covering to slow the spread of COVID-19 in public settings where other social distancing measures are difficult to maintain, such as grocery stores and pharmacies, especially in significant community-based transmission. So again, if you're out in public, if you go to the grocery store, it is suggested this time from CDC that you have a mask and that you're wearing it. So again, we hope you will do that. I've seen many clever things about making masks. There are some great videos out there. I don't know, Casey, I see her on there. We'll try to put some of those on our social media as well that show you some ways to make masks. So again, there are a lot of different things that are workable, but it does appear, at least when you know you're going to be in a public setting, to have a mask in a public setting. Let's see. CDC also maintaining the 6 feet, obviously, in the. I know the worst part is people call you and you're still trying to read. So again, these are some of the things. The executive order. We want to remind everybody the Safer at Home order from Governor DeSantis. As you know, Safer at Home is an order regarding essential services and essential activities during COVID-19 emergency. It went into effect on Friday, April 3rd, and expires Monday, April 30th, unless otherwise extended by subsequent order. The order requires all persons in Florida to limit their movement and personal interactions outside of their home to only those that are necessary and essential services and activities. Individuals within the city limits are expected to follow the governor's order, executive order from 2091. The executive order allows for essential activities, including going to the store and buying food, and doing things like going for a walk and getting exercise, but do so by maintaining the proper social distance. Also, just a reminder that it's not necessary to hoard or stock up items and food. We continue to work with all of our grocery and drug stores. All of our food is in our supply chains are still bringing in food and everything else to the city of Pensacola, so that we ask that you please get what you need for you and your family for the day, for a couple of days, but don't hoard up on supplies, because other people need those, and if they're just sitting in your garage or something, they're not doing anybody any service. I know the big question right now has been that I've seen in social media is certainly related to church services. Obviously, yesterday was Palm Sunday, and it's the start of Holy Week. So again, this applies to certainly Christians, but not only Christians, all of our houses of worship. We are asking in the city, while they are not prevented by the state of Florida from meeting, we've asked in the city of Pensacola for all of our houses of worship to find a way to provide their services in some kind of alternative virtual setting. Much like Facebook, I did Facebook yesterday. I put in a post on my personal Facebook page and just told everybody, again, there's some benefits I was on time. We usually have a problem being on time, but we were on time yesterday since we were at our house. And during the sermon, I was able to eat cheese grits. So again, there are some benefits, but we ask that you do this. And I realize this is one of the most important times during the year for religious celebration, but we ask that you please this week find a way to work with your house of worship to make sure that you can do that from your home. It is critical. And to tell you how critical it is, if those of you who aren't familiar with Albany, Georgia, or know where it is, I guess Albany, Georgia is in South Georgia. It right now is leading the world in per capita COVID-19 contamination. And you wonder how a small southern city got that way. Well, they had a funeral service where one individual went that was contaminated, managed to contaminate all the people in the funeral service, who then took it out and contaminated other people. So again, this is why mass gatherings are that's why we're not doing these. And we need to find a way as well in our churches to make sure that we're not doing that in all of our houses of worship, because this is how this can spread. There are ways, if we can do a press conference remotely, we can find a way to go to church and do our worship online as well during this pandemic. Park update: the city parks and green space remain open for people to enjoy responsibly, but playgrounds and other shared equipment are closed. And I appreciate Brian Cooper and his team making sure that all of our park equipment is closed down and is taped and marked as such. Please remember to stay off that. We, at this point, can't ensure how clean it is. So again, we ask you not to use it at this particular time. However, all our parks are open. I had the opportunity to go walking with my wife. We live right here next to Dunwoody Park off Baysden. You can walk in the parks and do it and manage a safe distance. So again, we ask that you do that. We've also removed basketball goals from city parks in an effort to prevent large gatherings. Governor DeSantis' Safer at Home allows for participation in recreational activities. We want to provide our residents opportunities to maintain a healthy lifestyle at our parks during this COVID-19 pandemic. Please remember, even in some of our parks, you may see heavy parking, but we are continuing to maintain and watch all those parks and make sure that people in there are conducting themselves per the order. Again, cars, you can't get this from car to car. This is truly a person-to-person pandemic. So again, if cars happen to be parked close together, that does not mean that the people in the park are close together. We are watching that in all of our parks. If you visit our parks, please follow the social distance guidelines and maintain 6 feet apart from yourself and others, and do not gather in groups. Again, we are continuing to watch that as we go. Sanitation update. Garbage and recycling are on schedule. Again, as I said earlier, yard trash is behind. Yard trash debris has increased from 35 tons a day to over 100 tons a day. That's a 185% increase. So obviously all of you are working out in your yard, and we're going to look really good when this is over and we get to summer, because we've done a lot of yard cleaning. So your sanitation services appreciate that. We're working on it. If we're slow getting to you, doesn't mean we're not getting there. It just means we are picking up a lot of stuff right now. So please be patient with us, and we promise we're going to get to you. Just have some patience. Yard trash is finishing up Tuesday route, and we'll start working Wednesday route noon time today. So again, it's Monday, and we're just cleaning up last week's Wednesday. So if you're a Thursday like me, I'm a Thursday route. There's still stuff all over my street, but again, they're coming to Cordova Park. They'll be here on the Thursday route soon. Everybody, we're working through it. We ask for everyone's patience as we get through this, and we're going to get there. Sanitation employee recognition. I really wanted to take a moment of privilege, because it's unfortunate we're not able to do what we do at City Hall and recognize the great things that some of our employees are doing. But we shouldn't just do that with our own selves. We should also share that information with you, the public. And this is one I really would like to share. I shared it on my personal Facebook page. Last week, city sanitation worker Ronald Booker noticed a woman slumped over in her vehicle. He stopped his route and checked on her and found her to be seriously ill. Booker called 911 for assistance and stayed with the patient until EMS arrived. Immediately, it was noticed that the patient was in grave need of medical attention. Even after she was loaded in the ambulance, Mr. Booker stayed, making sure her car and her residents were secured. Due to Mr. Booker's vigilance and decision to act, Responding paramedics believe that he directly saved this woman's life. So again, I certainly hats off, and anything we can do to recognize Mr. Booker. That's the kind of work that we're doing at the city. That's when people talk about engagement in employees. An engaged employee will go above and beyond and do the right thing, and that's what we're seeing, whether it's Mr. Booker, and he certainly had the opportunity to display that, but we're seeing that throughout city services all around. So again, thank you so much to what our city employees have done, and thank you, Mr. Booker, for doing what you did. Just also a reminder, LifeLock Services, this is just a reminder to those individuals who receive letters in the mail about the 1 year free LifeLock protection service that was due to the cyber attack that we had back in December. The deadline for signing up, if you have not signed up, is April 30th. So that is fast approaching. To date, 6,997 individuals have signed up with LifeLock service. Remember, this is only one of those who received the letter in the mail, there's a code in that letter that you got in the mail to sign up. So again, just want to make you aware that that deadline is approaching. Several things that we're continuing to work on this. Before we got started this morning, I had the chance to talk with Derek Owens. We are working, as I said, on Spring Street. Work is happening now on the Diet Project, and you probably see some new parking spaces coming in there. It is expected to be completed this week. That's kind of the light load of traffic that we're seeing. It's making it easier for us to get some of these construction projects done. So again, the Diet on Spring will be finished. By the time you get back out and about, there'll be additional parking spaces on Spring Street, and Spring will now be a 2-lane road between Main Street and Garden. The project is adding an additional approximate 50 spaces, so we're very excited about seeing those happen. Good Friday, we are already very light in what we're doing, but this is to remind you that on Good Friday, the city offices of the City of Pensacola will be closed on April 10th for Good Friday holiday. Again, during Holy Week, we will be closed. We just want to remind you that you will not see services open at this point. The good news is the move we made for garbage, there's no garbage sanitation pickup on Friday. So we should be done with picking up. We may be a little bit behind on yard waste, but we will get to you. But Friday, we will be closed for Good Friday. Sanitation should not be impacted because they're not picking up on Friday. That is about it. I simply wanted to say, again, we are working and continuing to work, and we know this is a trying experience that we're going through. Over the weekend, I did a little bit of research and looked up some things in the city. Looked up also the response to the Spanish flu. This is not unusual. We haven't done it for 100 years, but there are times where we did exactly this. And I know people are incredibly worried economically where we'll be. While I'm not saying it's going to be the 1920s, when you look at what happened coming out of the Spanish flu epidemic, we saw an incredible resurgence in consumerism that led to a full recovery. Again, I do believe, and I am sensitive to what this means to our economy, but at this particular time, the one lesson we learned from that was the communities that went quickest and went best at figuring out how to go into isolation protected not only their communities better, but they also positioned themselves better for recovery. And I think that's what the City of Pensacola is trying to do, and we're moving through. We have seen some increases. I was on the phone last week with all the hospitals. That phone call was very good. I think we have another call on Tuesday. I can tell you they are seeing a slight increase. They're still not anywhere close to their entire capacity, but at this particular time, we are looking at that. We're also, they've done a great job of figuring out that if we needed to, we could flex into the Navy hospital. There is about a week that has to be spent in getting us up and ready for that. And I believe they are already sort of going forward with some instructions to begin to do that process. So if something were to happen, we would be able to flex into that space. But at this time, they're all fairly low capacity. It is increasing, but we just continue to watch at this point. The measures you are taking by staying at home and taking this virus seriously is what's going to help us get through that and help them get through it. And it's going to better position us, as I've said, in the long run, not only for our own health, but our own recovery. So that's it at this point. I'm happy to take questions. I think Casey talked to you about how to get questions in. If you get questions, I'll be more than happy to talk and answer them.
Hey, Mayor. The first is from Andrew McKay. He said, great to hear your son is doing well. What are you doing to avoid being infected by proximity or contact with your son?
You know, it's one of those things. He was living in my mother-in-law's house, so he was living. The question was about my son and what am I doing to? I guess you heard that, Casey. I'm hard habit to repeat the question, but anyways, I was asking about my son. I will say he was living in his own house. We obviously had concern for him over the middle of the night. We didn't want him to have any serious chest contractions or anything else, so we did bring him up here. He has upstairs. He has his room, which he has his own bathroom, which is good, and he has a little den next to his room that he can go into. So that's kind of his area. That's the quarantined area. If he does not come downstairs and touch anything, we get everything for him and take it to him and stop up there. But that's what we're trying to do to make sure that we don't have as much cross contamination. We continue to work diligently to make sure things are clean. In the background, you might hear noise. My wife is cleaning dishes right now and making sure we're trying to stay clean, but that's where we are. That's another reason I'm not coming back until I take a test and figure out if you make sure that I'm clean and negative before I come back to the city. But at this particular time, it seems like those of us here in the family, we're okay, and we're not getting this. So at this point, that's just what we're trying to do and keep ourselves from not doing it.
All right. Also from Andrew McKay, is the city recommending employees other than PPD wear cloth face masks?
I think when we're out there, we're going to try to do that as much as we can. When we are in, I think is what was called upon when you're in settings where you're going to be in close proximity with people. Right now, we got everybody so sparsely populated at City Hall. But those are things, I think, as they go public, we would love to see happen. I don't know where construction workers are going to be that are doing stuff. Sometimes they'll have masks on anyways because of the construction work. But as we look at those things, we'll be evaluating every different department. We'll see and do it according to what they've got. So I know we're working through it. We've had our plan in place. I guess this also allows me a good chance to say, Keith, Kareth, Dick, and all their department heads have done an incredible job of making sure we've exercised a plan that has tried to bring our numbers down. Certainly we'll work within that. And let me also say Chief Leiter and Chief Craner. I can't say enough great things about Chief Craner. She's done an excellent job as our emergency person throughout this pandemic. She's done a great job of talking to us and getting us through this. So we're executing our plan, and I'm sure somewhere in there, the proper points that we need to do when those people are in contact, wearing masks will be part of it. And I will say, Andrew, how did you miss the Bluebird on your online? But anyways, that's an inside thing.
And this is from Jim Little. He said, Mayor, can you explain how you got your test results back so quickly, and what are you hearing from the hospital officials about testing turnaround times and what it is expected to be going forward?
I'll be happy to that. Sacred Heart has the capacity at this particular time to do about 50 to 60 tests in a day. And basically, I mean, it can be done as quick as an hour, but they typically turn it over in probably about 12-hour increment. Sacred Heart has that capacity at this particular time, but they can only do about 50 a day. Obviously, their first priority is going to be their PUIs. We've typically been running. I think we've tried to communicate that to you, and you've seen. I think as Janice Gillian and the hospitals are working to put out a new, a better chart that sort of explains this. You'll see PUIs have typically been running. Probably the person's under investigation in their hospital, probably about 20. That leaves they have a capacity for some additional overage. They had made a commitment to us that they would do our first responders first, or individuals that the city or the county felt needed to do that because of their connection with the public. So I guess in my position, I fell into that category. I mean, certainly I didn't want to be and Jim, you and I have talked about this personally. I didn't want to be contaminating anybody and not know it. So I needed to get that result fast. Part of my job is about being in the public. And if there was a danger where I was perhaps contaminating someone, I needed to know that fairly fast. So I fit within that 50 capacity they had. They had about 30 or 40 spots, and they were able to put me in there. And we've had the agreement, obviously, for them to do all of our first responders, because we need to know quickly whether they have problems or they don't, so they can either get back into working, or if they have a problem, we want to remove them immediately so they don't contaminate the rest of our force.
All right.
Hey, I see
And
Brian now.
This is from Andrew McKay. Has the city done anything to help the state improve accessibility for people seeking unemployment help?
We're going to work on that. That's obviously right now we continue to hear that. That's not a somebody's talking, but that hasn't necessarily been our issue. That hasn't been our issue as much, but we're going to see what we can do to help. We will absolutely do that. I do want to say we are going to be joining with the county has put forward $100,000 to go to SBDC for business recovery. We're going to be putting in an additional $25,000 from the city and putting that into it. So and that will be applicable for those businesses in the city, that just in the city limits. Again, I think the counties can be anywhere in the county, but again, we will be putting some additional dollars forward for that, and we'll continue to try to work with recovery on right now as any way we can in helping individuals get applied for that. If there's anything we can do, find out if there are any resources we can do. I'm going to be communicating with the governor's office here hopefully shortly. Mainly, it's going to be about the equipment that we need. Going back to Jim's question, how do we get a better job of doing this in going forward with getting this done within 24 hours or 48 hours, getting the test back? We need a piece of equipment. We're working with the state on that to acquire that. At the same time, I'll ask if there's anything that the city could do to help citizens here in Northwest Florida better access that and be able to get their information back. We will ask and see what we can do. At this point, we haven't been instructed. It's not something we normally do, but by all means, if we have capacity, we will put it in there. We think there could be nothing more vital than helping individuals get the payments they're already due. I can tell you that with the CARES Act, the city, all of our departments are looking at how we can apply for funding so that we can get funding here and we can put people to work, and we can also get city projects done with some of that funding. So we are absolutely, every department is doing that at this particular time. And again, hopefully soon we'll be seeing some of that money come to Northwest Florida and the city of Pensacola.
This is from Jeremy. Aside from Navy Hospital, has the city assessed any other properties for use in case of capacity issues at hospitals?
Right now, the hospitals, we're working with them and we're discussing. I mean, they have Navy and then UWF. They have some stuff that they would do there. We have not gone beyond that. Certainly, we have facilities we would open up to them if it got to that point. I hope, knock on wood, we're not there yet. We're certainly not even stretching the capacity we have, much less the flex capacity to go to Navy and UWF field house. But that would be the direction that was discussed at this particular time. They are continuing to work through that. The hospital execs are and their hospital staffs. So I'm sure they will figure this out as we move forward.
And this is from Rick. Who else has been tested in the city or county because of your concerns about possibly being positive yourself?
We did not end up testing anybody. I don't believe moved to test anybody in the city due to me because I turned out to be negative. I know Lauren, when I went home on Thursday, she also went home. So she is at home. But she was going to be platooning anyways. If I'm not negative, the challenge is it's hard to get tests just to say you've been by that. And I've talked to several people online about it. The challenge is they really want you to see some type of some type of symptoms before you get tested. And so that's what they're doing. So at this point, I don't feel like anybody else at City Hall, because I came back negative, needed to go test. If something should change and they develop symptoms, we absolutely will get them to call and try to get them in line and move them to get the proper testing. But at this particular time, we don't have anybody else that did get tested. I do know, I see Casey's there. I know Keith's there. I think Keith had some fairly significant cleaning that went on this weekend up on the 7th floor. So I'm sure Keith's going to say that we're going to just do that anyways, but I think it probably had to do with my son's positive test. So that's what we're trying to do at this particular time, but we will stay in touch. And like I said, for the most part, we're fairly well spaced up there, on the 7th floor, and we've really tried to ramp down who's all in the building. So at this particular time, we have not seen anybody indicating that they're displaying symptoms. So that's kind of where we are.
And the next question is from Jeremy, and I do have a response from Brian that I can read too. He said, how's the city's meal program with feeding the Gulf Coast going? Any changes, or is that still operating the same? I think Brian had some technical issues, but he did leave a comment and he said it's going well. He said kids are coming by each day and we have protocols in place to protect the public and the staff.
Oh, that's at the daycare that we're doing on Vickery? Yeah.
Sorry. Next question is from Andrew McKay. Andrew said, you and your wife are in quarantine. How are you getting ordinary supplies, or were you already prepared with a 2-week supply?
We were not hoarding, so we did not have supplies. But I will tell you, we did yesterday. We got groceries delivered. We did have we had a neighbor take some stuff for us at one thing, but for the most part, we've been able to get groceries delivered. So from that standpoint, we are still able to do some things there. So from that standpoint, you can avoid crowds. You can get your groceries delivered. I think different places and try to work through that. But we appreciate our neighbor helped us out on a couple of errands we had to run. So again, that's very helpful as well. As I said earlier, if you have a neighbor you know that you can help, we ask to do that. And also I want to thank obviously several neighbors here have baked cookies and delivered cookies for us. We appreciate that. Although I'm gonna have to stop eating cookies because I'm getting fat, but not getting as much exercise. But we do appreciate that. But again, that's the kind of community we live in. I think that's normal for us to display that kind of working together. If you know you have a neighbor in need, we ask you to please work to help them, and we're continuing to try to do the same thing.
And just to clarify, we were discussing meals at Vickery, not daycare, when on okay. Jeremy's question. Next question is from Rick. He said the county punted on closing non-essential businesses. Will you close any businesses?
Rick, I mean, earlier in there, I said clearly we expect people in the city limits to be following the governor's orders. I mean, that asks for non-essential businesses to be closed and move forward. I do know there's a whole list of what is essential businesses, and we're trying to work within that. Certainly we have a lot of people. We have things that are happening in operations that are private operations at our port or our airport that are continuing to open. We certainly have all our people with groceries and pharmacies that need to be open. We have other individuals that are providing food at some of our restaurants that are pick up and delivery. Those are all looked at as vital. But if you're and again, for office staff, we're operating at 50%. So again, if you're not essential in what you're doing, and certainly if you can do it from home, we are asking that you do that. And that's going to continue to be the city's position.
Next question is from Jim on parks. He said, did the city receive any complaints about crowds in parks this weekend? Brian did comment and he said not really. He said we did get one regarding people using playgrounds, but you can add to that if you'd like.
Yeah. And I was going to add the one thing I did see again, I saw a number of people talking about the Bluffs. In the Bluffs parking lot, there are cars there. It was packed out on cars. Again, the cars don't transmit the virus. But we are continuing to look at all of our parks and maintain and see that they're properly utilized. So at this particular time, we are seeing that, and we're going to continue to be vigilant about being in our parks and make sure that we don't have large groups getting together. We see proper social distancing. As long as people can enjoy our parks and do that, that's what's more critical to us, not necessarily how close the cars are parked together.
And the next question is from Rick, a follow-up on testing question. He said, what about the county? I think he means anybody at the county being tested because of your situation.
I mean, obviously, I know I communicated to some of our other elected officials who I was at the event. I'm not sure what they've done related to their testing. I'm not sure what their staff has done related to the testing. That I would say that was the most relieving part of getting the test results back negative was not so much, I didn't really care about myself as much. I was very concerned of what I may have exposed other people to. So I was very glad to be negative. But I don't know anybody necessarily that's telling me that they've gone one way or another and what's happening. But if anybody feels like they need to get tested, I would suggest that they call. I do know with the calling guidelines, I know that typically just saying that you know somebody or have seen somebody who has the virus, unless you're feeling symptoms, they're probably not going to test you at this particular time. But again, we're still testing a lot of people. We've moved up, even Sacred Heart's moved up over 3,000. I don't know where we are total system wide, but we got a lot of people tested, so that's a good thing. So I hope they get every single person that they feel they can get, and we get those results back as fast as we can.
Next question is from Jeremy. Have any city employees or first responders tested positive other than the firefighter mentioned last week?
The only one I know is the firefighter. I know that we had at last check last week, we still had about 14 city employees that were out because of this. One of them was a spouse tested positive. The employee had not tested positive, but the spouse did, so they maintained in their quarantine. And again, we had the one police officer. I don't believe we ever tested him, but the way he came back from international travel, we already assumed he was a positive, and so he was treated as a positive, even though I don't know whether he ever took the test or not. But I'll look for city staff to get back with me, and if we have anything corrected and different over the weekend, I know Casey, we can get that online if we've had any employees that have tested positive, what our numbers are.
All right. Next question is from Jeremy. What does operating at 52% look like? What type, if any, of city services are on pause to some degree?
Well, again, Jeremy, I think these are typically offices. These are office positions. Things like fire and police and sanitation. Those are not ones that are 52%. But I would also say those jobs tend to, we're trying to be smart of how we congregate people together. But for the most part, it's easy whether you're in the firehouse, whether you're on patrol. You can find a way to distance yourself. Typically, our construction crew is the same thing. So social distancing, I don't see being a real problem at those. The ones that we're down to 52% or so are more of our office staff. I do think we're using the technology. Do I think we're is up and full hitting our pace is what we could be? No, we're obviously a little bit impacted. But I also think our workload has dropped a little bit. You saw Tommy when he was there a week or so ago, and he said, hey, we've seen about a 30% decrease in calls because mainly traffic related. So we are certainly operating at less capacity, but I do believe the overall, flattening of the curve, everybody staying home, is also creating, other than yard waste. We seem to be creating less pressure and need on social services, city services at this particular time. I don't know specifically where we are on our feeding programs, but as you heard Brian say, we're still operating all those, and they're getting food out there to children, families, and to our senior citizens with council on aging. So we continue to do that.
And I have a follow-up question from Rick. He said, please be specific. Who at the county did you warn?
I communicated with Janice, with Commissioner Bender, Commissioner May, and the sheriff. I communicated with all of them my positive test. And obviously, after Friday, on the reporting that was done, I would assume more people who realized they may have been in contact with me would have also heard.
Okay. And just a clarification from Chief Leiter, he wasn't able to join because of some technical issues as well. But he said the officer you mentioned was not tested. He had no symptoms. He's back to work now. So when he came back from traveling, he self-quarantined.
All right.
And I don't see any more questions from anyone.
All right. You hear a cat meowing. Unfortunately, that's what happens when you do these stuff from home. But anyways, thank you very much. Casey, thank you for what you've done on this. Like I said, I'm proud of what we do at the City of Pensacola. I see us now at the cutting edge of what we're doing, trying to be virtual, trying to keep us so that you can be informed, so that we can inform you, but in doing it in a way that we're less connected to each other. I look forward to getting back to the day when we can all be together and we can be face to face. But until then, this is probably the smartest way for us to do it, and we will continue to be acting in that direction. So thank you for being here this morning. Casey, thank you, and Trudy, for the work that y'all are doing. And we'll get you back the answers. Any questions you asked that we weren't able to answer, we'll be sure to get those to you. Thank you.